All right, I think we're at 12:01, so I think we can go ahead and get started. Welcome everyone to the March 30th Teletown Hall meeting brought to you by the North Carolina HealthConnex. Today's presentation theme is closing care gaps. Just some housekeeping items before we start. This webinar is being recorded. And I just started the recording about a minute ago. Please put questions in the chat feature of WebEx. There's a little button, I have it shown here on the screen, where you can click the chat and that will pop up. And then when you do have a question, please send that to everyone in the group so everyone can see that question. And we'll try to go through questions at the end. If you have a specific question to your practice or group, please contact us directly and we'll provide direct contact information at the end of the presentation. So for today's Teletown Hall meeting, there are 5 key topics we wanted to cover. The first is CSRS, or Controlled Substance Reporting System. The next one is NC Notify. And then we have single sign-on, or SSO, bidirectional connections, and then we'll wrap up with clinical portal user management, and we'll take questions. So for introductions, my name is Garrett Smith. I'm the Business Relations Manager. We have Jonas Dusenberry. He's an application system specialist. He'll be covering the CSRS system, or Controlled Substance Reporting System. Tim Taylor, our application system specialist. He'll be covering NC Notify. Michelle Hunt, our data quality and integrity lead. She'll be covering SSO and bidirectional connections. And then Holly Elliott, who is with our SaaS technical team, or the help desk. She is our technical support analyst, and she will be covering the clinical portal user management part of the presentation. Before we get started, just a couple of quick updates from NC HealthConnex. So closing out 2021, we had 600 data connections completed or added to our total of 7,300 facilities that are connected and 140 total hospitals that have been connected. We also added Florida and Vidant Health to the queries to the eHealth exchange. And then important note here, our advisory board submitted a report to the General Assembly that outlined 2 things. One is connectivity status statewide, so that's who's connected to the Health Information Exchange. And then we also provided some recommendations that should be considered during the upcoming legislative short session. The report that is referenced here is located on our website, and it's linked in the presentation. This presentation will be sent out at the end shortly after, so you will have that link in the presentation to reference. There's also a link to who's connected, so that shows who is connected around the state, and it's a pretty neat and interactive map that you can use to see who is connected to the Health Information Exchange. And finally, we had a monthly update just released this morning. So it was sent out via email. It's also posted on our website at the link here. That's linked here in the presentation. And each month we're featuring a practice and showcasing how that provider sees utility in the Health Information Exchange Authority. All right, so I'm going to pass it off to Jonas Dusenberry, who's going to cover the Controlled Substance Reporting System.
All right, thank you. As Garrett said, I'm Jonas Dusenberry, an application system specialist, and today I'll be providing a brief overview of the HAE gateway to the NC Controlled Substance Reporting System, or CSRS. Next slide, please. All right, so the NC collects information on dispensed controlled substance prescriptions and makes this information available to prescribers and dispensers. The system is used as a clinical tool to improve patient care and safety while avoiding potential drug interactions and identifying individuals that may be in need of referral to substance abuse use disorder services. In addition, prescribers can also audit their personal controlled substance prescribing history. So if you're a provider who prescribes controlled substances, the NC helps you meet the STOP Act requirement. And single sign-on actually to NC HealthConnex will query the APRIS CSRS database. The NC creates an additional way for providers to access the state prescription drug monitoring program. And by providing 2 ways to access CSRS, this simple process does not require the user to log into another system outside of the HAE portal and is integrated into the portal workflow. So when the provider views the report, the system automatically records the access into the audit logs, providing support for CSRS user requirements in the STOP Act. That was a lot to say. Next slide, please. All right, so when a user actually logs into NC HealthConnex portal, they will search for a patient as they normally would. And upon entering the patient chart, they will see on the bottom left the option for a CSRS report on the bottom. You can see the arrows pointing there. Next slide, please. Thank you. When a user clicks on this CSRS report tab, they will be presented with 1 of 2 scenarios. If the user doesn't have access to CSRS, they'll be presented with the screen on the left, on the top left there. This screen presents info that the user doesn't have access, but also instructs them on how to attain access to the CSRS. And the other scenario, oh no, go back a slide. Thank you. The other scenario to the bottom right is if the user has access. They'll be asked to certify that they do have approved access and will be able to enter a report. Next slide. Thank you. So once inside the CSRS area, if the patient has relevant information, it will be presented in a pop-up window that you see here. And it lists information regarding NARC scores and overdose risk score. Now, if you don't have access to it, if you want access to information that's being for the patient that isn't being presented, or if you want to find a patient that isn't in the portal, we do have another method that you can use if you go to the next screen. Thank you. An alternate method for searching CSRS when there isn't a patient record in NC HealthConnex portal, or the patient may have opted out of NC HealthConnex, or you aren't in a record to utilize the CSRS report tab, is you would go to the top of the landing page, which you can kind of make out there. I apologize. The image is a little small. And once you click on that link, you'll be presented with the CSRS patient search screen, which is on the bottom left. From there, you must enter at minimum last name, first name, date of birth, and either the zip code or phone number. And again, this method does rely on having access to the CSRS. The same screens would be presented. If you didn't have access, you would be kicked out. And once you enter first name, last name, date of birth, and either zip code or phone number, you would be presented with a screen to the bottom right. Actually, I apologize. The screen to the bottom right is the one if you have access denied. Let me clarify. One on the left is access granted. The one on the right is access denied. But once you entered in and was granted access, it would bring up relevant information to the patient that you searched. All right. And that is all there is for the CSRS built into NC HealthConnex. And I will now hand over to Tim Taylor. I believe Tim is next.
All right, thank you so much, Jonas, and good afternoon, everyone. Garrett, with the thumbs up, can you hear me okay? I want to make sure my volume is okay for everyone. Perfect. All right, good afternoon again, everyone. My name is Tim Taylor. I am the lead analyst for NC Notify, which is the event notification service for the Health Information Exchange Authority. And today I'm going to give you a high-level overview of what NC Notify is and the types of providers that we have across the state that are actually actively using NC Notify, and how it's really benefiting them. One of the things that Garrett brought up in an earlier slide, he talked about the monthly update that just came out this morning. I would encourage you, if you can, go and take a look at that. We had, it was a really nice write-up this morning and some feedback from some users that were talking about NC Notify and how their experience impacted their care and their clinical operations. So I would encourage you to go and take a look at that when you get a chance. So the types of providers that are using NC Notify, it's a wide range of provider types. We have hospitals, primary care settings, behavioral health, even specialists that are using NC Notify. And so the very foundation for which NC Notify is built upon is keeping the provider and the care team notified or in the loop anytime that one of your patients has an event that happens anywhere within the care system. And that's regardless of EMR. And just a little bit about my background. Prior to coming to the HIE, my background was in healthcare operations management. So I've worked on the clinic side of things, but also within hospitals as well, from management operations. And I remember the days of fax machines, and we were relying on relationships with local hospitals to find out if and when our patients had encounters that we may not have known about. With NC Notify, it certainly helps to bridge that gap, because it's one thing to have those close relationships in the community where you are, but and as I'm talking about this on this example, Garrett, if we could go to the next slide, I'll really be able to show you the true benefit here. But it really helps to bridge that gap when you have a tool like NC Notify that can keep you in the loop and in the know when your patient has an encounter somewhere else. So now with that, what we have here on screen is a high-level example of the very foundation of NC Notify. So now the greenhouse that you see up there at the top, let's just say that this is your organization, right? And you are a full participant to the HIE. Now, just to put a pin right there for a second, in order to utilize NC Notify, your organization has to have a signed full participation agreement with NC HealthConnex. And if you need more information on that, all of my contact information will be listed within this presentation. I'm happy to help navigate you through that. But after you've signed that full participation agreement, NC Notify actually has a separate enrollment, and I'll walk through that in a second as well. But once you've enrolled to the service, going back to this example here on screen, let's just say that you're fully enrolled. This greenhouse is your organization, and the purple guy there, we'll call him Tim. The purple guy there, Tim, is one of your patients, or one of your members. Tim and family goes out of town, and when they go out of town, let's just say Tim falls ill, and he needs to get to the nearest ED or urgent care that he can. Well, at the time that Tim registers at that clinic or at that ED, an ADT message is going to be created. ADT standing for admissions, discharges, and transfers, which is represented here on screen. You see the X-ray there. But that organization that Tim landed at is actually going to send that ADT message back to the NC HealthConnex team. Now, because your organization is enrolled to NC Notify, you've provided us with a member roster or patient panel, letting us know who you'd like for us to monitor for you. Now, going back to the example here on screen, once Tim lands at that facility and the ADT message is sent to NC HealthConnex, the system will then scan that patient's information, scan Tim's information, and once it's identified that Tim is a match for your organization, we have the ability to immediately push that notification back to you and your team. That's the nurse represented there on the bottom left. So the immediate benefit there is you guys can be made aware of that event, and you'll receive high-level information about Tim's visit at that organization. Now, a common question that I'll usually get is, Tim, what kind of information is listed within that notification? the purpose for these notifications is really just to provide you with a high level. It's a high level notification that lets you know that, hey, this event happened. This is who it happened with. This was the chief complaint. This is what landed them there. This is where it happened, the time, the date. So it really helps to serve as a catalyst to start that follow-up process, right? It's also a great tool for care coordination within your clinic, and also not only within your own facility or organization, but it also opens the door for your care team within your organization to then reach out to that outside organization that I mentioned a second ago. No one knows your members or your patients better than you do. So just imagine the benefit being able to receive that notification in near real time. And so as soon as you receive it, it's highly likely that, Tim is probably still sitting in the waiting room at that outside facility. So there's another benefit right there where your organization or your care team can reach out and work, and coordinate care with the other care team at that outside organization as well. So just kind of wanted to point out a couple of benefits there. But I mentioned some of the different provider types that utilize NC Notify, and there's a number of ways that your organization can receive these notifications. But there's one that I really wanted to point out today that has been very popular for the last couple of years, probably last year and a half, and that's the Notified Dashboard. And Garrett, if you could transition to the next slide, I'll just talk about that a bit at a high level. So this is what we refer to as the NC Notified Dashboard. Okay, and I'm just going to do a quick walk around the dashboard so you'll kind of understand what we're looking at here on screen and tie it back to the example that I used just a second ago. Okay, so again, fast forward. Your organization has already signed the full participation agreement with NC HealthConnex. You've enrolled, and you've already communicated with the Notify team. Tim, we want to use NC Notify and we want to use the dashboard, right? So fast forward. This is the dashboard that you would see. So on the left-hand side of the screen, you'll see a number of charts listed over there. And I'll just mention, since we have the screenshot up here, that of course, all of this information is fake information and just used for today's purposes to give you an idea of how this works. So on the left-hand side of the screen, this is where all of your event notifications would populate in near real time. So as these events are happening, literally within minutes of these events taking place, you guys are being notified about it. So let's just go with Ernie there. The first chart that you see at the top. Well, actually, let me point this out, because from my days in the clinic, this would have been really, really helpful. So I want to just share this with you. If you notice on each one of these charts over here to the left, each chart has 4 lines beneath the name. Okay, so why is this important? So first, at a glance, if a member on your care team is looking at this dashboard, they can quickly scan and prioritize by chief complaint which patient they would probably need to go ahead and reach out to. So if you look at the first line of each one of these, it shows you where the patient went. The next line shows you the time and date, the type of event it was. If we're going to stick with Ernie, this was a emergency room registration. But that fourth line is probably the one that your care team is really going to focus on the most. That being, Ernie had chest pain. There's another chart here showing a fall. So if I was on the care team and I see Ernie had chest pain, that's probably going to be a red flag for me to go ahead and prioritize Ernie. So when I click on Ernie's chart over here to the right, this is where you're going to see the more detailed information about that visit. At the top, you'll see Ernie's demographics, and this is going back to where, the example I used, where we can go ahead and start that follow-up. We can go ahead and reach out to Ernie. You see his phone number is there. Also, you'll see some other key information there. You'll see it's his primary care provider. That can really be helpful for your care team to know. And just below that is where we get into the most recent event. That section of the event notification, where it's going to tell you, the chief complaint or the patient complaint. If you look to the right, you'll see that Ernie had chest pain. And over to the left there again, it'll give you more information about where Ernie went, time and date, and things like that. Now, before I go to a couple other features on here, something else that I often point out, because this would have been really, really helpful having this type of tool when I was in the clinic environment, but is the event history. Okay. So let's just say that instead of chest pain, this was maybe leg pain or ankle pain. And then I look down in the event history and I can see where Ernie's been to 4 or 5 other EDs within the last month or so. That's really helpful for me to know. That's really helpful for my care team to know, and may change our course of action, in our follow-up. So just kind of wanted to point that out because that could be critically important as far as Ernie's care plan moving forward. A couple other things here before I transition. If you notice just up still on the right-hand side of the screen, if you look up, you'll see a field where it says add filter. And just next to that, to the left, it says saved custom filters. This will actually allow your team, your care team, to build custom filters so that instead of seeing all event notifications, you'll only see those that are most meaningful to you. And so you can build these filters and save them. And once you save them, they'll go to that other field over there to the left, save custom filters, so that every time you go in, you don't have to keep recreating the same filter over and over again. And lastly, the last thing I'll show you, about middle way the screen there, just to the left of Ernie's name, you'll see a black arrow that's pointing down. That is the export function. So if you wanted to export all of these notifications, that's the that button is actually where you could go to do that. Now you could export that to Excel or some other data analytics software of your choice. But that has proven to be pretty popular across many clinics that we work with as well. So now, Garrett, if we go ahead and transition to the next slide. And although we have transitioned, I'll just say this about the last, the dashboard feature that we were just talking about. And I do this often. I do this quite a bit. If your organization would like to enroll to NC Notify and use the dashboard, and I know this is a lot of information, packed into this 10 minutes that I have here, I'm more than happy to jump on a call with you and your team, and we can walk through the dashboard and even set up some filters so that you get the information that's going to be most meaningful to you all, and that you can provide really efficient follow-up to these patients that really need it. So now to the slide that we're looking at here on screen, this is a recent development. I think we released this last summer. Basically, this is our new online web-based enrollment form. And I can drop the link for this enrollment form in the chat. Again, just want to point out before I close here that in order to participate or use this NC Notify service, again, your organization has to have signed a full participation agreement. But when you click the link that I'll provide in the chat section, it'll take you to this page and it'll ask you some pretty basic questions, just confirming that you've signed that agreement with us. And if you haven't, it'll actually take you to the participation agreement link so that you can read about that more. But this is actually what you're looking at here on screen is actually an upgrade. Before it was a PDF document. It was a fillable PDF document that would be signed and oftentimes printed out to then be scanned back to us. It's much more efficient now, where you can fill everything out right online. And when you click submit at the end of this web-based form, you'll get a copy and then we'll get a copy as well. Now, what will happen after that? After I get the copy, I'll basically review all the information that's on there that you've selected. And then I'll reach back out to you and have a conversation to make sure that you fully have a good understanding of everything that you selected and make sure that it's the best fit for your organization. Now, what makes this such a big enhancement to the PDF form? Over here to the right, on the right of the screen, you'll see it truly is more efficient. It's certainly faster for your onboarding time. It's shortened it by at least 2 weeks, being able to do it this way, having everything right there in one place. And the reason for that being these last 2 bullets, there's really detailed explanations within this web-based form. Almost everything that you select there's a bubble that will pop up and explain to you what you just chose, which is a great enhancement from the PDF form. And then lastly, also, because you're already on our website, much faster access to frequently asked questions. So, I've seen where organizations have started filling out this enrollment form and they have questions about the selection they're about to make, and they can quickly jump right over to our frequently asked questions, and have those questions answered. But again, even like I mentioned with the dashboard, I'm also more than happy, as you're going through this process, I'm happy to jump on with you as well and go through the enrollment form with you so that you fully understand exactly what it is, that you'll be signing up for. And with that, that's all that I have for NC Notify. I would love to talk to you more about it and work with you to help get you enrolled and get you started down this path. So my information will be listed here, but at this point, I'm going to pass it over to my colleague, Michelle, with single sign-on. Thanks, Garrett.
Thank you, Tim. So just as a reminder for the attendees, Tim and Jonas just discussed the ways that users can access data from within the NC HealthConnex clinical portal. But I'm going to speak to you now about ways that a user can access data from NC HealthConnex from within their EHR via either a single sign-on or via a bidirectional connection. Garrett, can you please go to the next slide? Thank you. All right, so this slide, let's start talking about single sign-on. And the first question you may have is, well, what is single sign-on? So in this context, single sign-on, or also called SSO, will permit access to the NC HealthConnex provider clinical portal directly from within the participant's EHR. So you won't have to log in via a separate web page with a separate set of credentials once single sign-on is configured and enabled with NC HealthConnex. So advantages of single sign-on include easier user administration of clinical portal credentials, and also easier integration of clinical portal access within your clinical workflow in the system you're already using, your EHR. So North Carolina HealthConnex, we already have a pilot underway with the Athena EHR. Some of you may be aware that we did send out a survey last year, back in August of 2021, asking for volunteers to pilot this functionality, and Athena did sign up for the pilot at that time. This work was funded by the High Tech Act, so just be aware that that funding did end last September, so that's why we started last year, and that work is still underway. Once the pilot with Athena is complete, Athena EHR participants will be able to move forward with the single sign-on offering. So there will be more to come on that topic for those of you on the Athena EHR. If you don't have Athena and you're still interested in using single sign-on within your EHR, the next steps will be for you to reach out to your EHR and let them know that you're interested and ask them to contact the HIE for next steps. Now, I just want everybody to be aware that new single sign-on integrations with an EHR other than Athena will probably not be kicking off until early 2023. So I just want to be realistic about the timelines. But if there is interest in that, please contact your vendor and have them contact us, and we can get them in the queue and establish capabilities. Next slide, please, Garrett. Thank you. So this slide will show you some screenshots of what single sign-on looks like from within the Athena EHR. And if you look at that left-hand image, that shows the menu item that an Athena user would select. So the user is in a patient record, and on the left-hand side of the screen, they would choose third-party applications. And then if you look at the top of the screen, you see that other screenshot. The user will then see that area pop up, and they will choose the third-party application they want. In this case, it would be HealthConnex. Once they click on HealthConnex, then the user is directed into a window that opens up with the patient search results within the clinical portal. So they don't have to exit the EHR and go to a different web page. It's all within the EHR system. And in this example, the user was in Darth Vader's chart in Athena, and then they clicked through to HealthConnex in the third-party applications list, and then they would see a list of patients that qualified for that search result, and they would choose the patient. Once they selected the patient from that list in the lower right-hand side, then they would be directed into the patient record, just like you would if you were accessing the portal via the website. And you could navigate to different areas of interest like encounters, diagnoses, lab results, radiology results. All of those things would be available at your fingertips. So I hope that helps to show you what this might look like in your EHR, especially if you're on Athena. This is what it will look like when enabled. And Garrett, if you can please go on to the next slide. Thank you. Okay, so that was single sign-on. That's a way to access the portal from within your EHR. There's another option for bringing data from NC HealthConnex into your EHR, and that is a service called bidirectionality. So a bidirectional connection, what is it? A bidirectional connection involves data flow in two directions, both to the HIE from the participant and from the HIE back to the participant. So the graphic on this slide shows the flow of data. In the image, you're going to see the flow of data from the EHR to the HIE. Once data is entered on a given patient into the EHR, it flows to the HIE. Now, for those clinicians or participants who have a bidirectional connection configured and who have a care relationship with the patient, they can then readily access the HIE aggregated patient record from directly within their EHR. So essentially, they pull the data back into their system. Now, what value does this add for a participant? First of all, the EHR end user can stay within their workflow in the EHR and pull data down into their system. Bidirectional connectivity with the HIE also satisfies the MIPS bidirectional measure. And this functionality may reduce the need to phone or fax other providers that are using a different EHR. If you can pull data directly from the HIE for other participants who are submitting data to us, then that can really close that gap that may be present right now. And just a note, the HIE does have the ability to filter out other providers or networks in your data sharing network, and that would be to reduce duplication of data in your system. So for example, if your EHR already shares data with other users on that EHR, we can exclude that data from being pulled back into your system because that would be a duplication of data. Additionally, we can work with you on how you want to receive the patient's care summary. So we have some flexibility there. We could deliver a consolidated CCD, which would include all the data in the longitudinal patient record, or we can provide an episodic CCD. So you need a CCD from a patient visit on this day. We could just supply that kind of information. So I hope that helped clear up some of the concepts and methods with which you can pull data from the HIE into your EHR. And now that we've discussed that, I think we're ready to talk about clinical portal user management. And for that discussion, I'm going to pass the presentation over to Holly Elliott. Thank you.
Hello, everyone. I'm going to be talking about everything that I'm talking about is going to be geared towards the Participant Account Administrator, or PAA, for your organization. And then again, this is back in the web-based portal. This isn't something you do through a bidirectional connection. It was through the web-based portal. And then just a little bit about your role as a PAA. One would be user management that I'm going to talk about in the next few slides. Also, the quarterly user account audit, and then you're typically our primary contact when we send information out to organizations. And the PAA role is within the portal is where you can see a list of your users, and only those on record with the NCHIE, the North Carolina Health Information Exchange Authority, should have access. PAA access should be limited to those on record. Okay, next slide, Tim. So there's several roles that users can be provided in their access to the portal. Slide's a bit difficult to see, but clinical the clinical role allows users complete access to patient records, whereas clerical would be patient demographics only. PAA only would be just a list of users and some of the tools that I'm going to show you. And then there's a dual clinical PAA role. And that would allow you to see not only patient records, but the PAA tools page. There are other roles that you'll find in the user management spreadsheet that pertain to NC Notify. And that, again, as Tim said, is a separate enrollment process. And once you're live with that process, we can assign NC Notify access to your users. Pardon me. Next slide. So user management all starts with the user management spreadsheet. You can download that from within the portal, or you can contact the help desk at HIE support at SAS.com to request the template. Generally, when we create an account for a PAA, we fill out the template and send it to you so you've got something to start with. So one important thing about this, I'll go into more detail about those, the roles and the columns that I'm showing on this slide. One important thing is that you do not delete rows from within the spreadsheet, because there are drop-down menus that are hidden in the spreadsheet. And if you remove those rows, you'll lose your drop-down selections. And sometimes the spreadsheet won't upload for us. Okay, next slide. Okay, so there were several columns shown on the spreadsheet. Column A is the facility name as it appears on your participation agreement. And some of this, if you have a question, just reach out to us and we can let you know how that name appears in the portal. The facility code is also something that we assign, and if you don't know that, we can let you know. Again, when we create that first account for the participant account administrator, this is generally on the spreadsheet, and you can see it as an example of how you would fill it out for other users. And then you select a role from within the drop-down menu. I'll show some examples on the next sheet. And then the user IDs must be in the format facilitycode.first.last. There are some cases where accounts were created long ago where it may not follow that format, and we'll know what the current format is. But typically we give you an example. And then columns E and F are last name, first name. And then column H is email address. It's really important that that each user has an individual email address. So we don't want nurse@abcpediatrics.com. We want it to be something that only that individual can access, and for security purposes, because when you do patient searches and things like that, it is audited, and we'll talk about that when we get to the quarterly user account audit. And then column J, you select true to create an account, false to disable account. Next slide. So you start by logging into your NC HealthConnex portal. If you don't have an account, you can reach out to us and we can take steps to create one if you're the PAA. And you'll log in. If you can't log in, you can also reach out for a password reset. Once you're logged in, if you have the PAA and clinician view, you'll click on the PAA tools page. If you only have the PAA role, you'll automatically land on this page. And here you can see recent patient searches, but you're going to go onto the tools page where you'll be able to manage users. Next slide. And here's an example of what you'll see. So you'll make your request. You'll select the request type, which is create user, update user, enable user, disable user, or reset password. And you can also type other things. When you fill out your spreadsheet, what you're going to do is put your request there, create user, and then you'll upload that spreadsheet to the portal and click submit. Once you do that, a ticket is created for the help desk. You can also simply send it to us at HIE support@SAS.com if you prefer. Do one or the other, because doing both creates duplicate tickets. So you can either submit it through the portal, or you can fill out the spreadsheet and return it to us. So again, you can also request users be disabled, and you do that by, go to the next slide. You select your users shown in this example, and then you would say disable user or reset password. And then when that ticket comes to us, it's going to show which users you want disabled or which ones you want us to reset passwords for. When we reset a password, we're going to reach out to that user. We don't work through others to reset passwords. We're always going to reach out to that user. And then again, it's important that we only take user management from the PAA on record. So if you're not on record, you, although you might have access to the portal, we're going to talk with whomever is on record to get you access if they want to add you as a PAA. Any questions about this, please reach out to the help desk. We're happy to help you. Again, it all starts with a user management spreadsheet that you fill out, send to us, we upload to the portal, and then that creates the users, and we let you know that we've done that. Emails are auto-generated to each user, so they have their login credentials and a default password to use. Again, if you want to disable user accounts, you would select those, or reset passwords. You select them from within your portal where you see your list of users, and you select those names. Next slide. I'm going to talk a little bit about direct secure messaging. So this is a service that's free to you as a full participant of the North Carolina Health Information Exchange. This again is something like NC Notify, in that there's a separate enrollment process, but this one you do through the help desk. So if this is something you're interested in, contact the help desk and we'll send you the application. It's a very easy process, and once you have a domain, individual DSM addresses can be completed for your users. So what does DSM do? It allows you to send PHI through a secure network to providers who also have DSM accounts. They must have DSM as well. May not be through us, could perhaps be through another HIS, but they also must have a DSM account. Benefits: increased reporting capability for meaningful use or promoting interoperability, and then better visibility into your practice's DSM usage. And then again, it's a free value-added service available to participants with a full agreement. And again, the DSM requesting, once you have a domain, requesting accounts is done through the user management spreadsheet. The fields for the, it's all on the same spreadsheet. These are just the fields that I'm covering that get filled out for adding DSM to user accounts. The DSM address will follow the domain name that you've requested when you enrolled. It'll be first.last@direct, and then whatever your domain is, .nchie.net. NPI numbers. We want the individual NPI number versus an organizational NPI number. So they all should be unique to that individual. If a user does not have an NPI number, perhaps because they're clerical or not a provider, then you would leave that blank. Put in your telephone number, mobile number, and address. The address needs to match what's on your enrollment form for DSM, whatever you've added when you made the request. And then you can also, again, upload the user management spreadsheet to the portal or send it to us at hiesupport@sas.com. Either creates a ticket. Okay, now I'm going to talk about the quarterly user account audit. Again, this is done quarterly, and the Q4 2021 audit ends tomorrow. So if you've not done that, please reach out to us, or if you have questions, reach out to us, or go ahead and just submit the audit. This is for all PAs that have access to the portal or who have users with access to the portal, whether you're using it or not. So some of you may not log in very many times, but just simply access it requires you to complete the audit. Again, it's unrelated to the status of your connection. It simply has to do with your access to the portal. So you're going to be asked to, next slide. There's going to be a chart where you see all your users listed, and you're going to see their user or patient search activity. Patient search will be anytime they look up a patient. Break the seal would be anytime a user looks up a patient that doesn't have an MRN associated with your organization. So if you're not connected live in production, every time you look up a patient, you're going to be having to break the seal. This is perfectly fine. You'll be provided, you'll need to click why you're opening the record. And this is just to ensure that the system is secure and that only patients that need to be looked up. It's a way to maintain security for our patients and for providers. And then again, if you see, so you're going to look at your list and you're going to determine if there are users who no longer need access to the portal. If that's the case, you're going to request that they be disabled. Those who may no longer require access to the portal would be those who are perhaps no longer with your organization, or perhaps they've moved to another role where they no longer need access to the portal. And you'll report any unusual activity to the authority. This is entirely determined by you as the PAA. So you may have a clinician who sees many patients a day and needs to pull up records. So the behavior may be something typical that you would expect from them. But perhaps you have someone in your organization who should only be looking up records from time to time. And if you notice unusual activity, you would report this to the authority for more investigation. And that, again, is determined by you as the PAA. You know your users. So you make your selections. You make sure if you need to disable, you let the help desk know either through the portal request or you send an email to us. And then once that's done and everything looks good to you, you're going to go to the next screen, Garrett. And you're going to read what you're attesting to. Again, it's user access and then user activity. And you'll type your name as your legal signature where it says click to enter your name. And then you'll click attest to this audit. Once you attest, you'll get an email confirming that you've attested to the email address associated with your portal account. And then we'll also get an email indicating that you've filled that out. Again, the next quarter will begin April 1st, and this will be monitoring Q1 2022. And that will start April 1st. It goes until the end of the quarter. So you have a full 3 months to complete that audit. Failure to do so may put you at risk for losing access to the portal. So we want you to take care to do that. Again, any questions about user management, DSM, reach out to the help desk. We're happy to help you. And then, so here again is our contact information. The HIE at nc.gov is the website. You can find a wealth of information on there, frequently asked questions. Also, the training and tools page has user management guides. I spoke about the PAA reference guide. That's on that user guide tab within the training and tools menu or page. And then also the user audit. There's the clinical portal user guide, lots of information there, and then as well as past Teletown halls. And then if you want to sign up for updates, you can do so on the hie.nc.gov, the website. Those others are the contact information, HIEA at nc.gov or HIE support at sas.com for the help desk and user management. Okay, Now we're going to turn it over to for questions. Again, if there's anything you want to hear about on a Teletown Hall session, let us know. We're happy to perhaps talk about those topics in a future presentation. And now you can go ahead and use the Q&A feature to ask your questions. Again, if you have something specific to your practice, please email us and we'll get back to you. Or if there's a question we didn't answer during this presentation, you can go ahead and send an email to us and we'll get back to you.
Thanks, Holly. Let me just go through some of the questions that we got coming in. I think some of them have been answered, but others have not. So there was a question about is this only querying the CSRS for North Carolina, or does it look at neighboring states as well? I think Jonas put in a response to this question, saying that the gateway connection is limited to North Carolina, but if you log into PMP Aware, the CSR direct system, you can access additional states, and you can read the rest here, and he has a link to that information. There was a question, is it mandatory that providers sign up for the HIE Act? I'm assuming that question is regarding connecting to the Health Information Exchange. It's required for providers that receive state funds. There is an FAQ on our website that goes through the details of the mandate, and we can follow up and provide that if needed. Just reach out if you need more information, but there is an FAQ on our general website about that details. There's a question from Zachary, and it was, as a tech vendor that supports NC or North Carolina TPs and CMAs, but an organization that does not directly provide services for individuals, can you point this group to the appropriate resources to get integrated with NC Notify via patient lists, independent of sending any ADT data to NC HealthConnex? Tim, how do we want to address that question?
I'm sorry, Garrett, I lost connectivity there for a second. I came back in when I heard you call my name. So
no problem.
Terrible timing, but
no problem. So there was a question, as a tech vendor that supports North Carolina TPs and CMAs, but an organization that does not directly provide services for individuals, can you point this group to the appropriate resources to get integrated with NC Notify via patient lists, independent of sending any ADT data to NC HealthConnex? Do we want to maybe have Zach, you can provide him your email?
Yeah.
Okay.
I'm going to drop my direct information in the link. Zach, I'd like to talk to you directly. I'm about to drop my contact information in the chat right now.
Okay, great. And then
Thank you, Garrett.
no problem. So Deborah Peters asked, can you tell me exactly which information is required to be shared with North Carolina HealthConnex for my outpatient mental health practice? Due to the confidential nature of psychotherapy, I would like to make sure patients are fully informed on what information is being required in case they decide to opt out. So let me take a look at some information. Let's see here. Just add it up. I'm going to come back to that question. Hold on one second. And Deborah, there is a policy. There's policies on our website, but I think let's see here. So per HIPAA, psychotherapy notes should be partitioned in a provider's electronic health record, so they should not be shared. So that is I think, and then we have policies associated with that. So I think that's key, is that the notes should be partitioned and shouldn't be shared. Let's see. There's a question here for anyone on ECW. If you turn Prisma on, you can get Hilo Insights, which does the same thing. Is that? I guess that's just a statement. And the PowerPoint's going to be sent out afterwards. And our quarterly user audits required if we are only using NC HealthConnex to send required information through our EMR, but are not accessing the web-based portal to obtain information.
Yeah, I answered that question.
Okay.
If you have access to the portal, whether you're using it or not, yes, you do need to attest to the quarterly user audit.
Okay.
Based on access.
All right. And then let's see the next question. If we start using the SSO capability with Athena 1, do the audits show in the portal for us to make sure we are keeping track? You might have already answered that.
Yes.
Okay. We already have bidirectional interface. Mean we will get full points for meaningful use measure. We already have a bidirectional interface. Not sure I'm clear. I guess that's for meaningful use. I think it's Ms. Patel, if you could reach out via email just with this specific question. We do have somebody that works with our meaningful use attestation items, so we can try to provide you with a response on that. Are we able to send cancer registry information to them via NCHEA? Is that so? Are we able to send cancer registry information to? I'm not sure on that one. Michelle, are you aware?
We might need to take that one back, Garrett.
Okay. And let's see, I see. Okay, Deborah, I think you mentioned maybe a town hall about a specific town hall focused on behavioral health. That is something we could do. That's a good point. Yep, and Ashley mentioned the same thing. Yeah, we can. I think we've actually done a couple of, or at least one behavioral health focused town halls, but we can definitely have one again since we're nearing the mandate deadline. So I think that's everything for questions. With the folks that will, a couple of questions need follow-up, obviously. This has been recorded, so I will follow up with a message that contains the recording and a copy of the PowerPoint presentation. And here's the contact information, which will be in the PowerPoint. Feel free to reach out. We really appreciate your attendance. And I hope you have a good rest of the day. Thank you.
Hey, Garrett.
Yep.
Just real quick, just in case anyone was wondering or was curious, I know it's been addressed in the chat, but I felt it may be worth saying out loud while we have the audience. The question was, how do we sign up for the individualized training for filters and things like that?
Yep.
As it pertains to the dashboard? The way to do that really is as simple as sending me an email, and my contact information has all been listed here. If you'd like to have a one-on-one conversation or training, please feel free to reach out to me directly.
Sounds good.
All right. Thank you, Garrett.
Thanks
Everybody.
Have a good rest of the day. Bye.